Good day, everyone. Today I am going to discuss Chapter 5, the Adlerian Therapy. So I will skip the common terms that we have already discussed on our past subjects, and I will proceed to the therapeutic goals of the Adlerian therapy. So the therapeutic goals of the Adlerian counseling and therapy rest on a collaborative arrangement between the client and the counselor. In general, the therapeutic process includes forming a relationship based on mutual respect, a holistic psychological investigation or lifestyle assessment, and disclosing mistaken goals and faulty assumptions within the person's style of living. Additionally, the main aim of this therapy is to develop the client's sense of belonging and to assist in the adoption of behaviors and processes characterized by community feeling and social interest. So next is the therapist's function and role. So therapists often gather information about the individual's style of living by means of a questionnaire on the client's family constellation, which includes parents, siblings, and others living in the home, life tasks, and early recollections. So the counselor also uses early recollections as an assessment procedure. Early recollections are defined as stories of events that a person says that occurred before he or she was 10 years of age. The process of gathering early memories is part of what we call lifestyle assessment, which involves learning to understand. So next is the client experience in the Adlerian therapy is all about helping clients to discover the purposes of behaviors or symptoms and the basic mistakes associated with their personal coping. Additionally, through this therapeutic process, the client will discover that he or she has resources and options to draw on dealing with significant life issues and life tasks. So sa Adlerian therapy, ang relationship daw dapat ay equal, and it is based on cooperation, mutual trust, respect, confidence, collaboration, and alignment of goals. So next, we have the application of the Adlerian therapy and its therapeutic techniques and procedures. So Adlerian counseling is structured around 4 central objectives that correspond to the 4 phases of the therapeutic process. The first one is the phase 1, which is establishing the proper therapeutic relationship. Second is exploring the psychological dynamics operating in the client. Third is encouraging the development of self-understanding. And lastly is the helping the client make new choices or reorientation and re-education. So the phase 1, which is establishing the relationship, the Adlerian practitioner works in a collaborative way with clients, and this relationship is based on a sense of interest that grows into caring, involvement, and friendship. So Adlerian therapists focus on making person-to-person contact with clients rather than starting with the problem. Clients' concerns surface rather quickly in therapy, but the initial focus should be on the person, not the problem. The phase 2 is assessing the individual's psychological dynamics. The aim of the second phase of Adlerian counseling is to get a deeper understanding of an individual's lifestyle. During this assessment phase, the focus is on understanding the client's identity and how that identity relates to the world at large. In the subjective interview, the counselor helps the client tell his or her life story as completely as possible. The process is facilitated by a generous use of empathetic listening and responding. And then the phase 3 is encouraging self-understanding and insight. Adlerian therapists interpret the findings of the assessment as an avenue for promoting self-understanding and insight. And then phase 4 is reorientation and re-education. This phase focuses on helping clients to discover a new and more functional perspective. Clients are both encouraged and challenged to develop the courage to take risks and make changes in their lives. And now we move on to the Adlerian therapy from a multicultural perspective, and we are going to look at the strengths of the therapy from a diversity perspective. So Adlerian therapies tend to focus on cooperation and socially oriented values as opposed to competitive and individualistic values, while its shortcomings are the approach also has limited effectiveness with clients who do not understand the purpose of exploring the details of a lifestyle analysis when dealing with life's current problems. Next is the contribution of the Adlerian approach. The contribution of the Adlerian approach is that it is suited to be brief, time-limited therapy. Adler was a proponent of time-limited therapy, and the techniques used by many contemporary brief therapeutic approaches are very similar to interventions created by or commonly used by Adlerian practitioners. And then next we move on to the limitation and criticisms of the Adlerian approach. So Adler's written presentations are often difficult to follow, and many of them are transcripts of lectures he gave. Adler's global reach was unprecedented, but he did not attend to the way his work was translated. So that would be all today. Thank you for listening.